Hello, my well-being buddies. Welcome to this session on self-harm. Now, this can be quite an emotive subject. So what I want us to do is just take a minute to make sure that we're in a safe space, that we feel pre-grounded, and that you're able to get help if you need to get help. So if you are in crisis right now, it's important that you go to your safe space. You invoke some of those grounding skills to help de-escalate you, to manage this intense feeling that you're feeling, and just take some breaths to distract yourself and look at some of your coping skills. If you're unable to keep yourself safe or others safe, then obviously please ring the emergency services and then go to your local A&E as part of a crisis plan. Equally, if you're known to your GP or secondary services, maybe you've got secondary healthcare numbers, give them a call to let them know how you're feeling. So let's just start off with the session around self-harm. So we're going to look at what self-harm is, how it's caused, some of the risk factors, understanding some of those signs and symptoms, looking at how it's assessed, look at some of the ways it can be treated, and again, looking at some of those medication options. So self-harm is a complicated, stigmatized behavior, and it can take form in lots of self-injury ways, such as cutting, burning, scratching, hitting yourself, amongst other things. Unfortunately, self-harm is often done in secret, and many people do not seek the help they need. It is difficult to estimate the exact numbers. However, there was a systematic review done and a meta-analysis published in 2019, and it was an estimated global prevalence of 16%. So we're looking roughly 1.5 people for every 10. So quite high prevalence. So we've just discussed what self-harm is there then. So self-harm here is when somebody intentionally damages or injures their body. Support is available for people who self-harm or self-injure. And this includes support for family and friends because it can be quite difficult for people to understand. So what causes self-harm? Well, there are many things that can cause self-harm, but most and paramount, it kind of boils down to a coping skill, a poor emotional regulatory coping skill. And it's something that people turn to feel something. So when people self-harm, and I've spoken to many people in the past who self-harm, and I asked them, why? What triggered you to do it? And they go, I just wanted to feel something. And therefore, it gives you an idea on the depth in which somebody is feeling with this emotional numbness. Or it's become a behavior, a coping strategy to manage this intense feeling. And therefore, they turn to this as a coping strategy. So none of this is anyone's fault. It's not behavioral. Because that's not helpful. It is a very difficult, complex, emotional, and a regulatory imbalance and a skill, a poor coping skill that's been learned to manage these overwhelming feelings. And what the most important thing here is to be non-judgmental. Because the moment you're judgmental, the moment you have an opinion on this, the moment you start to say the wrong thing, you can make somebody feel worse and inadvertently re-trigger that self-harming behavior. Now, a lot of people that I've spoken to that have self-harmed in the past don't mind talking about why they do it. In some ways, some people feel relieved to share it. However, I would never force somebody. And if somebody started to bring up trauma, I would generally stop them because what I don't want them to do is relive trauma that they've been through, because again, that's unhelpful. What we want to be doing is keeping the risk level low. We want to be able to support people. And from a practical point, if there is a self-injury there, then we address the self-injury if the person wants our help. There's a high possibility that the person self-injures and they've got the mechanisms and tools to manage that self-harm and self-injury. What we need to be asking is suicidal thinking and suicidal thoughts. So, have you got suicidal thinking, and is there suicidal ideation going on there? And if there is, then we need to manage that risk. And again, I'll do a session on suicidal ideation thinking and how we can assess and manage risk. So, let's start on where we can get help for self-injury and self-harm. So it's important to know that support is available for everyone that self-harms or injures, as well as support for their family and friends. And it does start off by talking to your GP about the self-harm. And again, you may find listening services really useful there. So charities and organisations that can help. Free listening services can be Samaritans, the Shout crisis line, Childline services, or anything along those lines. Equally, there is a self-injury support web chat for women and girls. There is the Calm web chat. And if you're under the age of 25, there is a website called The Mix. So again, lots of self-referrals, talking services in which you can go to where you don't feel judged. And what's important to talk about the Childline number, if you're under the age of 19 and you ring that number, it doesn't appear on any phone bill. So when do you seek help from the GP? Well, if you're harming yourself, we need to teach you calming techniques and strategies to manage that, because there are other ways of looking after yourself than through self-injury. Equally, if you're having lots of thoughts about harming yourself, because again, we know thoughts eventually turn into behaviors. So again, just thinking about those. Or whether you're worried about minor injuries, such as small cuts and burns. And again, if you're worried about infection. So making sure that we're doing that piece around keeping wounds clean, keeping injuries clean. And signs of infections might be that it's hot to touch in the areas, it smells, it could be weeping. So if you've got an infection, it's really important to go and speak to somebody. So how can the GP help? Well, first of all, they should be listening, and it is a priority thing here. You need to have that appointment quickly, and again, they will refer you on to self-help groups and support groups to manage your psychology. Equally, they may do a referral to the local community mental health teams, and they are your secondary services, formerly known as adult or commonly known as adult treatment services. Or if you're a young person, you may be referred to CAMS, the Child and Adolescent Mental Health Services. There's obviously more information on the website. If you go to the NHS website and type in self-harm, you will see lots of different organisations and charities there. So why do people self-harm? Well, again, it expresses that coping feeling. It shows emotional distress. It could be an opportunity for them to feel in control. It might be a way that they're punishing. It might be to relieve tension in the body, or it could be a response to intrusive thoughts. And maybe there's a sign of psychosis there. So maybe they're hearing things and seeing things. Self-harm is normally linked to bad experiences, and that's really what's going on now with somebody. And it's the reason that they can take control over what's going on in their body. Common causes for emotional distress. So some of the triggers here can be being bullied at work or being bullied at school, pressures at work or school, family arguments, relationship problems, money worry, low esteem. So these are all risk factors. Struggling with stress, anxiety, or depression, not sleeping, confusion about identity and sexuality. It could be some guilt after loss or bereavement. It could be a response to physical abuse or a continuing punishment. It might have something that's happened during a criminal justice system. So maybe they've been involved in services, or it could be something that they've experienced through other mental health distresses. So, for example, an impulsive behaviour or difficulty in managing emotions. And again, that piece around self-harm and trauma. We know that there is evidence of clear links between suicidal thinking and self-harm. So it is really important to get people the help that they need quickly on this. So, what can we do here to manage this and help? Well, if you've got something that's self-harming, it's important to find ways to prevent and distract them. Because if their mind is busy and their mind's distracted, they're not focusing on self-injury. And hopefully, through time, this will eventually stop, or it could stop on their own. However, that's not necessarily going to be the case for a lot of people. They may need that support and treatment and referrals to secondary services. And what you might find is a lot of CBT stuff, they feel it's a bit outside their remit, and you might need further support from secondary care. But anyway, ways that we can help people that self-harm. So we need to get people to talk about their feelings to their friends or their families or to those listening services that we've already done. So at least they're not bottling this up and they can get their feelings out. We need to help people get to a point with their feelings to understand why they're feeling that way and what leads to that self-harming behavior. And that way, we can look at those feelings of sadness or those feelings of anxiety, and we can teach people different ways of managing those feelings in a much more safer environment. We can try waiting before you consider self-harm to do things such as going for a walk, listen to music, trying something else that interests you, just to help that intensity and that pastime. It could be breathing exercises. So again, on your phone, you can download the breathing apps, and finding different breathing skills will lower your heart rate, lower that anxiety, and reduce the amount that your head is spinning and whirling. So really give you an opportunity to think clearly. Equally, you could go online and maybe you could read things. So this is self-help CBT stuff, and that's through mental health and wellbeing services. But if you are struggling with those suicidal thoughts and you are thinking about self-injury and you just can't seem to shift this, it's important to have a safety plan. And again, if you've never done a safety plan before, there are apps on your phone that you can download. I think it's called Stay Alive. Or alternatively, if you go onto the websites, there are apps or websites such as Staying Safe. And there's guides there how to make a safety plan. So how do you tell somebody about self-harm? What is it you can do? How can we get this out there? The problem is it takes time. It takes time to build a therapeutic relationship. And ultimately, we need to find people that we can trust. And if we can trust somebody, we can share this. And that could be, again, friends, family, trained volunteers, or other health professionals. We need to decide on the right time to talk. There's no point sitting down with somebody if it's going to be a quick session. People generally already feel abandoned and stressed and hurt and let down by some of the systems. And what we don't want to do is be another person that's creating that space, because again, we just reinforce that negative thinking. We obviously need to let people know what they're telling us. Can be difficult, but we shouldn't act shocked or surprised. But we need to be looking for help with them. So we need to be looking in that conversation about ways of supporting them. And obviously, we want to help the person with their distress, but without interrupting them. So that might take some active listening skills, really trying to understand why they're doing what they're doing. We need to talk openly and honestly and be clear about their feelings and why they're asking for help and the things that we can do. So again, really trying to build that therapeutic relationship, trying to get trust established. Again, let people ask questions, but don't feel that you have to answer them. So if you're not sure on an answer, just say, look, I'm really not sure, but we could look together, or maybe we could try something. And again, if you are looking for help or you're trying to help somebody, don't force people to show injuries and scars. People will show you if they want to. Don't force them, because if you force them, you're going to lose trust quite quickly, and that relationship in which you built will fall down quite quickly. So signs of self-harm and self-injury could be the fact that somebody's wearing clothes in inappropriate weathers. Maybe they're wearing long sleeves on a hot day, so they're trying to cover up parts of their body. It may be that you see a change in their behavior. Maybe they were outgoing, now they're becoming more introvert. It may be the fact that they're avoiding getting undressed or taking their tops off, or maybe they flinch away if they're worried about you coming near them. So it's about watching for those signs. It may be the fact that you see bruising on somebody, or those scars, or unexplained cuts in history. And if you question somebody, you might put them on the spot and then the stories don't tally up. So again, try not to do that. So what happens during a self-harm assessment? Well, ultimately what will happen is the person that you go to see, be it the doctor or a psychiatrist, they're going to want to talk to you about self-harm. So what is it that's led you to do this? They're going to ask things like, how are you feeling about this? What are your relationships and what are your living arrangements like? Have you tried things to reduce this? What do you think of and what are you thinking about? And would you self-harm again? And have you ever had thoughts about ending your life? So lots of questions to build up an assessment. And we call that a clinical interview. And in a clinical interview, we're just trying to establish what's going on and what the level of risk is. In the care plan, lots of things to help treat this on a natural level. So again, you might find CBT could be helpful. Generally speaking, it can be really helpful and a lot of people use it, but other things might be a little bit more helpful here, such as mindfulness-based cognitive therapy or dialect behavior therapy, DBT. Because in DBT, you make a commitment to the therapist, you make a commitment to yourself, and you make a commitment to others to keep yourself safe. So it's an agreement. All of those are talking therapies, and they're designed to help you manage your feelings and gain control over your life. Normally on a one-to-one, but sometimes they can be done in a group or over the phone. But again, talking therapy there is useful. When we look at medication for this, again, if we go to our normal baseline medication for non-medical prescribing, we're going to be looking at things such as omega oils, vitamin D, and your vitamin Bs. So again, anything that helps repair the natural pathways of emotions in the brain is where you're going to want to be. If you go to your doctor, it's not uncommon for them to prescribe medication for depression. And that's not because they're saying you're depressed, but the medication has therapeutic benefits alongside this. So you may find something such as sertraline helpful, and again, you'll be monitored. But it's important to recognise any of those SSRIs or any of the antidepressant medication could increase the risk of harm again. You should be given details of emergency contacts and who to call if you're in a crisis. Now, on the level of self-harm and the risk around self-harm, other professionals may be involved. And that's because it is a multidisciplinary approach. The risk is a little higher and there's lots of things we need to do to help manage this. So that's going to be maybe a social worker, occupational therapists, counsellors. You might have a mental health nurse, such as myself, or a community mental health nurse. You could find that you work with psychiatry, who are qualified medical doctors, but with further training in mental health. Or you might find psychology and therapists. So they're the people that might be involved. During this, as the story is unfolding, we will undoubtedly see some of the triggers. And that may be the fact that then you need a referral to ongoing services as well. So your journey wouldn't end with us, but we would need to do this on referral piece. And that might be because maybe you're doing this through grief and that bereavement piece. So maybe we need some coping skills with bereavement. Maybe you've been through some level of abuse and therefore we need to do a referral to some domestic abuse services to help manage that. It could be that you're self-harming through food and therefore through this inadvertently we have an eating issues, maybe such as bulimia or an eating disorder such as anorexia. So again, just being mindful that there may be other referrals. And as we progress through, it might be clear that there are other supports that's going to be needed here as well to help manage. So that could be things around alcohol misuse or substance misuses. So again, a referral on there to help as well. Ultimately, we're looking at a multidisciplinary approach to help with self-harm. So let's just go back again to those how we recognize self-harm. So it's about keeping yourself, if people are keeping themselves fully covered all the time in hot weather, as we said, it might be unexplained cuts and bruises. You might see blood stain on clothes or tissues, and there could be signs of pulling their hair out and other physical things. So you might find, I've seen people having bald patches here. I've seen people pull. I've seen lots of things. Equally, the emotional signs might be that they become withdrawn. You might see signs of depression, signs of low self-esteem, and then they're talking about ending things because what's the point? Remember, the things that you can do to help is encourage them to go to their GP, ask how they want to be supported, put them in the driving seat because this could be a control thing. Let them know that you're there for them. So you're not going to tell them what to do. You're just simply there to listen and help them problem solve. Again, try to understand their emotionals and their experiences without judging them. One of the things that I did, which I made a mistake once, which I learned by, was I kept coming up with solutions. And I remember somebody saying to me clearly, I don't want your solutions. I just want you to listen to me. But I was so busy in the task trying to help somebody that I forgot that listening was the solution. And again, let them be in control with the decisions. What to completely avoid? Obviously, don't try to force them to change what they're doing. If you take away that risk, the risk could increase and it would become much more dangerous. Don't threaten to take control away from their lives because, again, that can become dangerous. And don't insult them. Don't say, this is a behavior, you're asking, you're crying for help, you're attention seeking. Because if you do that, you're going to lose trust and it's going to become very difficult. Equally, self-harm is a really complicated, difficult subject. It can be distressing for everyone, including family members, friends, and people that work in the industry. So it's important that you also have help and support there for you to manage your feelings around this. There are lots of guides online on coping skills for self-harm, resilience, and grounding skills. Again, splashing your face with cold water, eating some ice cream, using elastic bands, rubbing ice up and down you, or going for a cold shower or bath. Just remember, it's okay to talk about self-harm. We need to be non-judgmental and be the listening ear and make sure that we're referring people for the right reasons. So, what is self-harm? It's anything that causes injury to oneself deliberately. What causes it? A whole heap of things, from loss, feeling in control, lack of control, bereavement, and again, those risk factors, which could be loss of jobs, bullying, work. Equally, the risk factor here is the fact that it could be accidental. We could do accidental suicide. So again, being very clear about those risks. And that's why we don't use any particular assessment tool here. We must use clinical observations to measure the risk and decide ourselves what the risk of harm is. We've looked at the signs of harm. So are they covering things up? Is the behavior changing? Can we see a change there? How is it assessed? So through that interview piece that we've just done. Again, how is it treated naturally? So we've looked at those normal ways of managing our mood, vitamins, healthy eating, lack of substances such as alcohol and smoking, etc. And what can we do to help manage that with the CBT and referrals and dialect behaviour therapy? And finally, the medication treatment normally is going to be something like an antidepressant prescribed by the doctor. Ultimately, what you really want to do is something that works with people in self-harm, or if you experience self-harm, you want to make sure you've got your safety plan and you want to make sure you've got your crisis plan. And if you haven't got those, you can go online and you can download them. And one of the things I highly recommend is downloading a crisis card. So if somebody does find you or you're in a dissociative episode where you're unable to communicate clearly because of your self-injury, then ultimately it will give somebody the numbers to call, and there are some advanced decisions there. Anyway, I appreciate this could be quite an emotive subject. My name's Steve, and I'm the mental health nurse. Thanks for watching.